Welcome to Weekend Prime. I'm Robinson Okenya, and Pretty Janet is on sign language. Now tonight, as the government launched the Social Health Authority sponsorship program to support vulnerable households at State House in Nairobi, it has emerged that members of SHA seeking services from facilities under the Rural and Urban Private Hospital Association, Rupha, will have to dig deeper into their pockets in order to access health services from facilities under the association. Rupha says beginning next week on Monday, its members will suspend credit services to SHA following failure by the government to settle at least 50% of the outstanding 43 billion shillings debt the authority owes facilities. Gloria Milimu reports.
As efforts to ensure access to healthcare services under the Social Health Authority takes a different trajectory, with the sponsorship of at least 558,000 households in what President William Ruto says will help at least 2.2 million indigents access healthcare free of charge under the Social Health Authority, a crisis is looming in the health sector, as members of the authority stare at an impending situation where they might be forced to pay out of pocket for health services from facilities under the Rural and Urban Private Hospitals Association, Rupha. Rupha Chair Dr. Brandy Sheng says a special meeting by members of the association Friday has resolved to proceed with the action.
Our notice expires at midnight tonight, and on Monday morning next week, we will be suspending credit services to SHA.
According to Rupha, the government owes facilities at least 33 billion shillings for services rendered under the defunct NHIF and another 43 billion shillings under SHA, a debt the association says has left facilities choking under the weight of unpaid claims. As of end of August 2025, healthcare providers had submitted claims worth 96.2 billion shillings and only 53 billion had been paid. Almost half of the claims are said to have been generated from lower-level facilities, with general inpatient and surgical services taking up much of the services rendered. The facilities had demanded for immediate settlement of NHIF liabilities in line with President Ruto's 5th March 2025 directive on payment of NHIF debts of 10 million shillings and below. Payment of at least 50% of the 43 billion outstanding SHA liabilities within the 14 days that lapses tonight, and constitution of a dispute resolution tribunal to oversee suspensions, downgrades, and investigations into facilities. Should Rupha make good its threat, experts reckon the move will affect access to care to hundreds of thousands of Kenyans who depend on the rural and urban private hospitals for services. As the government pushes to have more vulnerable Kenyans catered for in its quest for universal health coverage, the sustainability of the program has also come under sharp scrutiny.
Even as we prepare ourselves to pay, we must have that service, and that service must be of the highest quality. And that is why we are working with counties so that we can assist counties to have the requisite equipment to deliver.
The only way to guarantee that this group of needy and vulnerable Kenyans will have a medical cover next year is through parliamentary appropriation in the National Assembly and through county assemblies also appropriating money. We cannot have a situation where it is seen to be a sponsorship and an act of goodwill.
With only 4.8 million Kenyans out of the 26 million registered members of the authority said to be making their contributions, experts say the current SHA design is unsustainable. SHA also continues to face fraud challenges that have seen at least 31 out of the 85 facilities implicated in large-scale fraud investigated. Consequently, at least 544 health facilities have been closed by the regulating body KMPDC for operating without licenses or being unregistered, and revoked operating licenses of 454 facilities due to a range of violations. Gloria Milimu, KTN.
Learning in public universities continues to face a